So we have a three-person panel, and we ready to go? I'd like to begin by introducing the Executive Director of the California Medical Association, Dustin Corcoran. He's actually the CEO of the California Medical Association, and Dustin is somebody that we've had the privilege to work with. Dustin and his organization have partnered with us on a number of legislative issues. They're an organization that we consult regularly, both because of the fact that they represent 39,000 doctors in the state of California, including many of the doctors that we all work with. But we're really pleased and honored, and the final thing I would say about Dustin is we had the opportunity when we did that large Medi-Cal rally last year, the We Care for California rally. Dustin's organization was incredibly supportive. They have always been there when we've been ready to talk about how we need to change Medi-Cal. So please welcome Dustin Corcoran, the CEO of the California Medical Association. Next, I would like to introduce the woman who leads the California Primary Care Association, Carmela Castellano-Garcia. She is the president and CEO of the California Primary Care Association. This is really the network of community clinic organizations up and down the state of California. The members that Carmela leads provide health care to almost 6 million people a year, soon to be 7 million people a year. In the way I think about the world, Carmela leads the second largest health system in the state of California. She's also somebody who has a long history of advocacy and support and work around issues of Latino health, Latino social and economic justice, and please join me in welcoming Carmela Castellano-Garcia. We're pleased to have her also. And finally, I'd like to introduce Mark Larrett, who is both the CEO of the University of California, San Francisco Medical Center, and also the chair of the board of directors of the California Hospital Association. And Mark is somebody that, in what seemed like endless round of discussions that we had with the California Hospital Association over many, many months, Mark was always a principled voice, an open-minded participant, somebody who clearly, exudes leadership and has the support of his peers. But I think it's fair to say, without Mark's leadership at the board of the California Hospital Association, we would not have been able to reach the agreement that we reached with the CHA, and so we're also pleased and honored to have Mark Larrett with us here today. So please join me in welcoming Mark. So here's what we're trying to do. We have some questions for Dustin and Carmela and Mark, and we're gonna sort of just play it by ear as to how the conversation goes. But I would like for the first question that we hear from each of you, if you could explain to the member leaders of UHW, in your piece of the healthcare world, how important is the Medi-Cal program to the future of healthcare in California? And particularly, what insights can you share with us about how the future of Medi-Cal affects doctors, affects clinics, and affects the hospital industry? So Dustin, if you could begin on your thoughts for the future of Medi-Cal.
Sure. Thank you, Dave, and thank you all for having me here. It was a tremendous honor to be invited to share this time with you and to listen to Dave's talk. It was very inspirational and inspiring. As a matter of fact, Dave, when he originally invited me, had me leading the dance troupe that we just had for the break, and I was disappointed to get bumped from that to this panel, but I'll try and do my best to be...
we can create an opportunity to fix that before we're done.
Don't doubt the skills, Dave. Don't doubt the skills. Look, Medi-Cal is vitally important. to everybody in the healthcare profession. It's not just for physicians. I really think what I took away from Dave's thing was exactly right, that we're all in this together. This isn't doctors, this isn't hospitals, this isn't clinics, or anybody else sitting in silos and pretending that what happens to one doesn't affect the other. What really worries me with the Medi-Cal system and the way we're going and attacking it and thinking about it right now in the current environment is as though policymakers here in Sacramento treat it as an annoying line item in the budget that has to be dealt with, as opposed to how do millions and millions of Californians get their health care. We can't ignore millions of people and subject them to a second-class system of healthcare delivery. And for us, the physician community, you can't have a successful practice, you can't have a meaningful practice, you can't do what you went to medical school to learn how to do without a fully funded, without a respectable, without an honest accounting of the Medi-Cal program. So we are very honored and very pleased to be able to partner with UHW and with the clinics and with the hospitals and a lot of others to fight for a Medi-Cal system that honors the people that are enrolled in it and gives them the health care that they deserve and need.
Great, thank you. Carmela.
Well, good morning. It's really a pleasure to be here today. Thank you for having me be part of this important conversation. The importance of the Medi-Cal program really has to be looked at in the context of the historic times we are in with the implementation of the Affordable Care Act here in California and throughout our country. And certainly here in California, the Medi-Cal expansion was absolutely a cornerstone of the Affordable Care Act. I started as a healthcare advocate 23 years ago. As an attorney and civil rights leader, I have dedicated my career to advancing the issues of Latino healthcare access to care for the uninsured and the immigrant population in the state of California, and advocating for access to care for the state's most vulnerable population, Latinos, in terms of overrepresented in the ranks of the uninsured and low-income population, really standing the most to gain from the implementation of healthcare reform. So really the passage of the Affordable Care Act is a dream come true for someone like myself, and I think all of you in this room. And I would like to personally thank all of you for the critical role that you played in helping to ensure the passage of the ACA at the federal level, and certainly the Medi-Cal expansion in the state of California. Helping to ensure coverage for millions of Californians that would have been, and previously were, left behind. So how important is the Medi-Cal program? Well, it's vitally important for the community clinics and health centers that I represent, and particularly for the population that we serve. Nearly 1,000 community clinics and health centers in California serve 5.4 million patients a year. That's 1 in 8 Californians. Prior to the implementation of the ACA, nearly 2 million of our patients were uninsured. And the only place where they were accessing their health care was at the community clinics, and certainly others in emergency rooms that weren't getting their care from the health centers. And the overwhelming majority of these patients, Latino and people of color. Community clinics and health centers are playing a significant role in bringing Medi-Cal coverage to the previously uninsured population. We already had 2 million within our doors, and we continue to enroll these patients each and every day. And that is why our health centers have been true leaders in the issue of enrollment. In fact, we have over 2,000 certified enrollment counselors today in community clinics and health centers that are enrolling folks. And I know SEIU is playing a big role in the enrollment process as well. We're also working hand in hand with the California Endowment to promote the fact that Medi-Cal enrollment is ongoing, because we know that there are many who are eligible but remain uninsured. So we believe that the Medi-Cal program will continue to be critical to our health centers, to our patients, and to California's future. In fact, it's estimated that more than 40% of our own patients will be on Medi-Cal in the coming year due to the expansion. And this is going to give them access to very important primary and preventative services. Many may not have had them before. And it's further estimated that within 2 years, 30% of all Californians will be on Medi-Cal. Clearly, the Medi-Cal program is a critical piece of the healthcare system, particularly for communities of color and low-income individuals who without it would be without coverage. It's truly the backbone of our healthcare system and will continue to be for years to come.
Great. Thank you as well. On behalf of all the hospitals in California, it's a privilege to be here and a privilege to be part of this, this new partnership. To take on what I just want to underscore what Dave said. It's fundamentally a moral issue. 1 in 3 Californians now qualify for Medi-Cal in this state, a staggering percentage of our total population. And yet, the reimbursement structure of it is such that if this were a group of hospital CEOs sitting around in this room, they would be talking about how to reduce the amount of Medi-Cal volume in their hospital, how to get those patients out to someplace else because they lose so much money on taking care of every one of them. And what the heck kind of circumstance is that? I mean, if you believe, and I think Dave articulated it so well, that every person has the right to the same high-quality level of health care. There should be no haves and have-nots in terms of health care system. If you believe that, then you need to have a system that makes some kind of sense. And I'll just say, I often talk about Robin Hood and Sherwood Forest. We have a crazy situation in healthcare where our Sherwood Forest at our hospital has 3 types of patients coming through it. There's more, but 3 big categories. There's Medi-Cal patients, there's Medicare patients, and there's commercially or privately insured patients. And here's how it works. When a Medi-Cal patient comes through the door, through our forest, if we provide a service that costs us $100, guess how much Medi-Cal pays us? About $50. About half of what it costs. Half of what it costs to pay the staff to provide the services, half of what it costs to provide the supplies to cover all the services. If a Medicare patient comes through our hospital, it costs us $100. Medicare pays us about $90. And then, every now and then, a Blue Cross patient or a Blue Shield patient wanders through the forest, and we hold them up. And you know what we charge them? $140 or $150 for something that cost us $100. And why do we do it? We do it because we use that money to pay for the Medi-Cal patient. And now we got more Medi-Cal patients, we got fewer commercially insured patients, and the economy of Sherwood Forest is breaking down. So I'm just telling you, fixing Medi-Cal is a top priority for every hospital in the state of California.
So the second question we'd like to ask, and again, just for some context, you know, Dustin and Carmela work out of the state capitol here in Sacramento, and a large part of their responsibility is dealing with the day-to-day political and policy implications of healthcare. You know, Mark is the leader of a hospital in the Bay Area, but the question we want to ask is, you know, we have asserted here today that fixing Medi-Cal is fundamentally a political issue. So we'd like to hear your thoughts on, can we accomplish the goal of transforming Medi-Cal if we do not unify providers and advocates? And could you also give us some insight into how difficult a political lift you think this is? So starting with Dustin again.
Sure. Can it be solved without active engagement in the political system? Absolutely not. Medi-Cal is a state program. The state legislature and the governor decide how much it's going to be financed, if it's going to be financed, or whether it's going to be financed at all. And you've heard, and you all know quite intimately, how woefully underfunded it is, how embarrassing it is that we're last in the nation. What happens over in the Capitol all too often is a lot of us get platitudes, we get pats on the head, we all get victimized by our own self-interest and start separating and being picked off or allowing ourselves to be picked off one by one. Maybe the doctors go out and do something that's good for them, the clinics do something that's good for them, the hospitals try and get something that's good for them, and we all just try and be happy with our little piece of the crumbs that are left behind in the state budget. There is no way to take on the political intransigence that is there in Sacramento, that to get past those platitudes, get past the nice things that legislators like to say about Medi-Cal, and actually get them to commit the financing to Medi-Cal to make it work. The only way you get there is all of us getting away from those proprietary pieces, doctors being willing to put in the middle what's good for the common good, not just for our self-interest, for the clinics, for the hospitals, for SEIU, for the health plans, for everybody else, to put aside that and just say we're going to stick together. We're not going to be allowed to be conquered and divided for peanuts. We're going to stick together, we're going to make the system work, and we're going to make sure that it's financed. Can't get around the politics of the situation, can't get around the fact that it's the governor and the legislature that decide whether it's going to be financed and how appropriately it'll be financed. So what I am really encouraged about in the last year when we came together for the rally that Dave talked about for We Care for California, I can't tell you how fired up the physicians were to see all of you rallying for the common good, rallying for something that was beyond yourselves. It was inspirational for them. They took that to heart. They took it back and committed themselves to meet you in that same way, to be able to commit to work together for the common good, not for our little piece of the pie, and really to fix Medi-Cal for the long term.
Go ahead, Carmela.
Well, I think with each of us playing different roles in providing care, it's no surprise that we might have unique perspectives on the Medi-Cal system. But that being said, we're all here today because we agree that the Medi-Cal program is critical for the future of California. But Medi-Cal's challenges must be addressed to ensure the future of healthcare in our state. And in fact, we have a history, the groups here, SEIU-UHW, CPCA, the Medical Association, the hospitals, working together to address healthcare problems, to meet challenges, because I think we do share a common vision for a future healthy California. An example is that the association I represent, CPCA, is pleased to be part of the Let's Get Healthy California task force that SEIU-UHW played a leadership role in establishing to address Medi-Cal health transformation. This could potentially bring $100 million to the state of California in federal funding to advance delivery system reform. We've also been a partner in the We Care for California coalition that was just mentioned, that is attempt to address the issue of Medi-Cal rates, a very important issue. And certainly we all joined together to advance the Medi-Cal expansion, one of the huge victories for healthcare reform in California. So certainly all of us working together have shown the ability to get results, which is very critical. But certainly with the Medi-Cal program, there are a number of issues that need to be addressed. And for my constituency, just a few thoughts alone, we have the rural expansion. Medi-Cal managed care just went into 28 rural counties that previously didn't have managed care. We have significant issues of provider network adequacy, access to hospitals and specialty care. The workforce capacity issue is critical, impacting all sectors of the healthcare industry, not just the Medi-Cal program, just to name a few of the challenges that we face. But certainly with the leadership, excitement, and commitment of all of you in the room today and all of us, we can certainly make great strides toward improving and changing the Medi-Cal program and having a positive impact on California. But it won't happen overnight. And certainly it won't happen if we all don't come together, really like we have today, to discuss the issues that are impacting us and see how we can work collectively toward a common goal. But I think importantly, our work together needs to go beyond the Medi-Cal program. We need to look at the broader healthcare issues. There are many issues of critical importance, including the fact that millions of Californians have been left out of healthcare reform altogether. We can't lose sight of the fact that we will never truly have healthcare reform unless all Californians have access to coverage and care, including, importantly, the undocumented population. These are the issues that we also need to be working on, a united voice for the immigrant population, so that we can ultimately all achieve healthier communities and healthier lives. So is it a heavy lift? You betcha. But 23 years ago, when I got started in this endeavor, healthcare reform, the Clinton plan was introduced, and it didn't go anywhere at that time. But certainly it is a lesson in never say never. We had a bill introduced. That would look at providing Medi-Cal coverage for the undocumented population. Again, never say never. Maybe not happen this time. Maybe it's not going to happen the next time. But certainly we have hope that it's going to happen. So can we, joining forces, fix the Medi-Cal program? I think it is very possible. Thank you.
I'm going to start a political action committee to run Carmela for president. Fantastic. Hey, you know, Dave quoted some people this morning really beautifully. I was thinking about Benjamin Franklin's quote during the Revolution, and they were trying to sort out the future of the fledgling United States, the colonies. And he said, if we don't hang together, surely we will all hang separately. And I think that's where we are today. Was it obvious to the California Hospital Association that our partner in solving Medi-Cal was SEIU-UHW? No, it was not obvious. It took a lot of persuading, in fact. But I think we've already started to see, no, I'll strike that. We have, forget the I think. We have already started to see the benefits of collaboration toward a mutual cause of improving the healthcare system, moving toward the goals that Dave articulated earlier, and changing the dynamic between UHW and the hospital industry. So absolutely we have to work together. I'll just say one other thing. When I think about what is the Medi-Cal problem exactly, what, if you had to put your finger on it, you could go right just a few miles from where I live to Richmond, where Doctors Hospital of Pinole serves, I think they see something like 35,000 emergency room visits a year, huge volume, serving a community, and yet this hospital is going out of business. And why is it going out of business? Is it because there isn't a need in the community? Is it because no doctors will come there to provide support? No, there's a huge need. There are people willing to do it, but the payment rates from Medi-Cal, which covers most of those individuals in that hospital, or individuals who are undocumented or don't qualify for any support, there are so many of those individuals, the economics don't work. And I echo Dave's comments earlier. Do we really want to look at ourselves in the mirror and say, yeah, that's the kind of healthcare system I'm really proud of? Or do we want to say, no, we ought to hold ourselves to something better? And to me, the Medi-Cal problem is, it's a problem when hospitals and doctors start to ask, not, can I help this patient? Can I help this individual get better? But they start to ask, can I afford to take care of this patient? And that's the Medi-Cal problem. We can't afford to take care of the patient for the amount of the money that Medi-Cal provides, and we've been trying to take it from others to make it work. And we got to solve that problem, and we got to make it put it in very basic moral and ethical terms.
So I'd like to ask a follow-up question in two parts, and anyone who, I think it would be very instructive to our group. Part A is when your constituents, doctors, clinic leaders, hospital leaders, are sitting around, tell us something that might surprise us about what you discuss vis-a-vis Medi-Cal, you know, among yourselves. I mean, we think about the world from one perspective, but we'd be interested to hear if there's something you can share in that vein. Secondly, and you know, Mark said it in a very understated way about, you know, it was not obvious. In fact, all the signs were pointing to it not happening, that we would become partners because of traditional stereotypes and all of that. So we've tried to convey our willingness to reinvent ourselves, but also, if you'd like to share, what do your folks really think about us? You know? Because it'd be good to hear if you're willing to do that. So I'm not going to put everyone on the spot, but anybody who's willing to answer one of those questions, the stereotype question, and also, what do you talk about in your world when you're talking about Medi-Cal?
Well, I suppose you'd like to hear what the hospitals think about UHW. I'll just start with that.
Present company excluded, right, Mark?
I love UHW. What do you know? No, I think it's a mixed bag. And like all new bedfellows, if that's an appropriate way to think about it, that we need to get to know each other. There are many hospitals who are smarting at strikes that have happened that created huge tension. There was not uniform belief that UHW had as lofty an agenda as the one you heard Dave articulate this morning. There were a lot of concerns that this was about work rules or higher pay or other kinds of things. And I think there was a concern that organized labor in general does not appreciate, there's a lot of things we don't appreciate, of course, but the organized labor doesn't fully appreciate how much pressure the hospital industry is under to cut costs by commercial insurance, by Medicare, by Medi-Cal, and the struggles that the hospitals have just trying to keep the doors open and serve patients. But I credit Dave and the team for being persistent and laying out a vision. And today, I think there are a lot of hospitals who appreciate the direction and are seeing the difference of the approach that Dave has articulated and UHW is articulating versus what others are articulating. I'll just say at UCSF Medical Center, we had 2 strikes last year. I hate strikes. They represent a huge breakdown when you actually get to the strike level. And what we did not accomplish in taking those strikes is moving the ball 1 inch further toward solving Medi-Cal or coming up with a comprehensive solution that is going to be good for workers and the hospitals long term. That's what I regret about that. What I like, and I think what hospitals are gravitating to with the UHW relationship is we have the potential to do something big that can be mutually beneficial, and that's what we want to build on. So I think we've come a long way. We've got a long way to go. It's not done, but the fact is we're working together.
I think there's some of my folks who would share the sentiments that were just expressed by Mark in terms of concerns around trust or some of the tactics and challenges. But I think at the bigger level, this is the 20th anniversary of the California Primary Care Association, something I'm really proud of. And we are where we're at today because of a strong, unified voice for community clinics and health centers. And the theme for our 20th anniversary is shared destiny. And I think in some ways we have that with SEIU because I think at a fundamental level, and our members are very aware of and see the political clout and power of this organization, and also that when it comes to advancing the issue of healthcare access in California, that we do share that same vision and mission. And so ultimately, I think that is what people do see in SEIU, a true leader in the state of California in issues of healthcare access, very helpful in terms of making the Medi-Cal expansion happen here in the state. Ultimately, I'm sure a big role in when we get coverage for the undocumented population. And I think really that is what is recognized in what SEIU brings to the table.
Let me first start, Dave, by talking about what doctors think about when they think about Medi-Cal. When you get my board members, when you get them in an unguarded moment, and they just start talking about what it means to be a doctor, you really hear the humanity come out, and they're reminded of why they went to medical school and why they want to be able to treat people and why they feel awful about being stuck in this conundrum about having to think about how many Medi-Cal patients can they realistically take into their offices and still be able to keep their doors open? And who do they have to turn away and not provide care for? And is that part of their moral being and part of their moral compass of being a provider? My president runs a private practice just 90 miles north of here in a little town called Paradise, California. He's also the chief medical officer of the clinic in the town. He hasn't paid himself in 4 months because everybody up in Paradise, California is undocumented, uninsured, or on Medi-Cal. He's struggling right now to keep his doors open. He's struggling to be able to pay his staff and be able to provide the care that he needs. He is wrecking himself right now whether he can continue to do what he thinks he needs to do, what his obligation is as a doctor, his duty to his patients, his duty to his community, or whether he needs to make a change and start doing something with a higher level of compensation. That's not a place any healthcare provider should be. Whether they're a physician, whether they're a nurse, whether they're a home healthcare worker, nobody should have to face that conundrum about thinking whether they can care for the people that they believe in and that they want to care for. And I think that's the spot that we find ourselves in. So when we think about UHW, what do they think of you? 10 years ago, if you would have asked the California Medical Association, where do you view your place in the world, it would have been sitting at on the board of the Chamber of Commerce here in California. When you ask them where do they view themselves now, it was at that We Care for California rally with UHW. It's about joining with you to make sure that Healthy California, that the work that the endowment's doing to try and extend benefits to the undocumented is successful, to make sure that Covered California actually succeeds in this state, that we have a healthcare system that we can be proud of. And I can tell you how far they've come from 10 years ago when I talked about them thinking that their world was the Chamber of Commerce. After our work with you, their exposure to not just UHW, but to a lot of other unions in the state of California, I can tell you how we end our board meetings now. At the end of our board meetings, we do something that you did just before we came up here on this podium. We end the board meetings with a bunch of doctors.
All right. I want to thank Dustin, Carmela, and Mark. We are really privileged and honored, and you know, this is part of how we change the future, their willingness to engage with all of us. We are grateful. Thank you for coming. Thank you to all of them. Wonderful.